So first I'm going to start about a little bit about the environment. So when you're working on, if you're thinking about virtualizing your clinic and you're thinking, what does that even mean? Some things to be aware of that we find that we've gotten feedback from different clinics that have made the transition successful is, you want to make sure you have a headset. You'd be surprised if you're on a laptop, you'd be surprised how much even shuffling papers or typing echoes a lot within the session. So if you can get some sort of headset, I find the gaming headsets work the best because they got a lot of nice features to them, but even something simple like, earbuds with a mic built in, that'll work as well. So you want to get something like that if you're going to conduct virtual sessions via Zoom or any virtual medicine tool. Another piece that users have found helpful is if you have access to two monitors. The idea being that, if you're seeing patients, it's good to have your EMR up on one monitor. You can have, PACS or whatever other tools you need on one monitor. And the other monitor can then host the actual Zoom session. So you have them side by side. If you're in an environment where you don't have access to two monitors, folks have gotten creative where on their computer where they do have EMR access and all those types of tools, they'll keep it that way, and they'll use their smartphone or they'll use an iPad or a tablet to join the Zoom session, and they'll kind of prop it right next to the computer. So you don't have to do it that way, but it's a lot easier when you have dual monitors to be able to have the video always there and then your EMR for reference, so you're not, bringing one window up over the other all the time. It can get kind of confusing if you have multiple windows open and you start to lose basically where you're at. So if you have the option for dual monitors, that's preferred, or some other device. The next piece is if you're working as a clinic staff and you're booking patients on behalf of physicians, and these are virtual visits, we recommend not using the built-in Zoom scheduler. What we're trying to do basically is we're trying to create an environment as you virtualize to keep it as close to what you're used to. The more things that are different, there's a bigger learning curve and it can create more anxiety. So, if you normally book your clinics and you use Outlook to notify the doctors or their daybook or the EMR, we suggest using the same mechanism and getting a generic clinic email for the booking piece. The reason why we say that is if you book directly out of the physician's Zoom room, the email address that they have tied to it will be exposed. The patient will see it when they get the invite, and that patient, I guarantee you, will email that physician whenever they have any kind of issue going on at all hours. So we're trying to buffer that away from the patient. So by having a generic clinic email, and we suggest if you don't have one already that you communicate with, just go create, your clinic name at gmail.com or something like that. And then give that to your booking staff, your MOA staff. We recommend basically using that to communicate all patient visits to the patient. And then for the physician, in their daybook or an Outlook or whatever you're used to booking for them anyway, note in there that it's a virtual visit and they need to start their Zoom room at the scheduled time. When that happens, what's sent to the patient is simply a URL to their room. That URL is static. It always ties into their room. So if the patient clicks on it, what happens then is the patient will automatically be put into the waiting room, similar to how all of you were in the waiting room before we admitted you into this active session. That is your security. There is no way a patient or anybody else can jump from the waiting room into an active session at all. You have to manually admit them into the room. So that is the big lock, that is the big proverbial lock on the door that cannot be circumvented at all. I know there's a lot of discussion about, certain groups are requiring a password and they require a URL that changes every single time. Well, what we found is, while those are additional potential security, what they actually do is they create a barrier in usage, because now it's like, okay, do I have the right password? Do I have the right link? And what we've had from feedback from physicians and staff out there is we need to make it as easy as possible. So, if you have this unique URL, there's nothing that prevents the patient from forwarding that around to anybody, and anybody can try to jump in. So the way we've approached it in our suggestion is have the waiting room there. That is your security mechanism. With RCCBC accounts, the waiting room is forced on and locked on. There is no way to turn it off, even by accident. So what happens is whenever a patient clicks on that link, it's the same link. It avoids confusion, especially if you have chronic disease management. The patient's maybe being seen once a week. If there's multiple links floating around, it's going to get confusing. We suggest that the MOA staff or the booking staff have maybe a sheet in front of them that says, you know, these are the doctors that I'm booking for, and this is their unique URL. And so when they communicate that patient visit or that appointment to the patient using the generic email, they would simply put in the URL of the physician they're going to see and send it to the patient, say your appointment's at such and such time, click on this link at that time. The patient jumps into the waiting room. They will wait there as long as they'll wait there indefinitely until the physician in the room manually admits them. Later on in here, when we start doing some in-meeting navigation, I'll demonstrate what that looks like from the physician point of view and how you bring somebody into the waiting room and how you can move people back and forth from the waiting room if you need to. So that's what we suggest you do. The waiting room is your final lock. No one can circumvent that. So we feel that that in the RCCBC is sufficient security to prevent anybody from Zoom bombing. Bringing up Zoom bombing, I'm sure all the stories out there, I think it's important to touch on this right away. All the stories out there with Zoom bombing and all these security issues with Zoom, they are not applicable to the healthcare version of Zoom, which is what RCCBC and all the health authorities in BC are using. The health grade version is a contained version. With the enforced waiting room, it is impossible to Zoom bomb a room. So those kind of horror stories you hear out there, those are happening on the educational version or, you know, the free version. And, you know, a lot of educational entities out there, they're trying to create that lecture room experience, right? So the door is wide open in the lecture room, meaning anybody can jump into that lecture room. So this is how they have uninvited guests coming in and throwing things up on the screen. They've done it because they've left that lecture room type of format wide open. They've left the door front wide open. So that's why that's happening to them. That does not happen with the healthcare grade versions. That it's not possible for any of that to happen. So I wanted to make that very clear. Another point about the healthcare version is, you know, there's some discussion about, is there, you know, are there servers in Canada or are there only servers in the US? There's two answers to that. There are servers in Canada in Vancouver, Montreal, and Toronto. So it is contained in Canada. That said, all traffic that happens only traverses through the US. And what that means is nothing is ever saved in the US, nothing ever stays in the US. It just goes through the data centers in the US to increase performance. Now, we have the control to turn that on and off, as do any health authority who have Zoom accounts. They can force where their traffic goes depending on their specific policies. So I just wanted to touch on that piece because everybody always loves to hear, you know, talk about the security of Zoom, and there's a lot of talk around there that it's not secure and this and that. Those are referring to the different versions of Zoom that are not the healthcare grade. The healthcare grade do not have these issues. So just wanted to touch on that. So basically, those are some best practices that we've had feedback from physicians and clinics as how they virtually decided to conduct business. Again, keep it as simple as possible to how you've always done business as you virtualize. The less new things there are, the easier it is going to be to adapt to this brave new world. So I'm going to start sharing my screen. I'm going to start showing you different things on the screen. The next piece I want to show you is how to get the Zoom client. You can join this via a web browser, but we recommend if you have the opportunity to use a Zoom client. I know most health authorities have packaged and installed the Zoom client, so it's available on health authority computers. But you can also conduct a full session via the browser. You can use it via Google Chrome. That's the best browser to use. The browser-based version does not require a plugin like a lot of other meeting tools out there. They make you install a program. The browser version uses a technology that doesn't require a plugin, and it just runs right into the browser with nothing added that you need to do. So I'm going to share my screen and start showing you some of this stuff here. So, let me take my carport off. Okay, so first thing I want to show you is this. Where do you get the Zoom client? And I'm going to sign out here. And if anybody can give me a thumbs up, can you see my screen? Excellent. Okay. So if you need to get the Zoom client to get started, you're going to go to zoom.us. This is the URL right up here. You can see it there. So once you're there, in the top right, you're going to see a resources, which I've clicked on here, and you'll see the first option is download Zoom client. So if I click that, it brings me here. There's some plugins that you can use in Outlook and those types of things. All you're looking for is the top one, the Zoom client meetings. You would hit download and go through the install. and then you'd be ready to log in with your account. It's important to note, sometimes people ask, well, how do I know what version of Zoom is the right one? You don't have to worry about it. The Zoom client is the same one for all the versions of Zoom. When you log in using your account, where your account is or the type of account it is, which again, all the health authorities and the RCCBC accounts, they're the health grade account. When you log into that account, into the client, the Zoom client itself gets hardened to the point where to match the level of security that is required for the type of an account you have. So you don't have to worry about, do I have the right one? Am I secure? If your account is with RCCBC or one of the health authorities and it's the health grade account, when you log in, everything happens behind the scenes to ensure that that privacy is maintained and security concerns are met. So I'm going to go ahead and sign in. I'm going to show you the web portal. And this is something where when you first get your account, it takes you to this, and this is where you can set up your name and those types of things. So up here, if I want to sign in, I'm going to go to the sign in button. And I already have my email address in here. It's auto-populated. So I'm going to go ahead and sign in. So what it does is it puts in this profile. You can see on the left column, there is a personal section, and then below it, there's an admin section. You won't see the admin section. The admin section is there because I'm the owner of all the Zoom accounts on behalf of RCCBC. You will see the personal section. The personal section is where you can make settings for your own account. You'll see there's some things that are locked in there, and they're locked for privacy, and they're done so at a global level to ensure nobody accidentally turns something on or gets into a situation where they've exposed themselves. So in here, I'm not going to show you everything in here. I encourage you to poke around and play around in here. But the key things I'm going to show you are, right now, you can see in my account, I have Dave Harris there. If I wanted to change that, I can hit edit. And in here, it gives you an opportunity to enter more information. The rest of the fields here below are irrelevant. You can decide to populate them. They don't really show up anywhere. It's a moot point. But if you wanted to, if you're a physician and you want to label it, Dr. So-and-so, this is where you would label it. This is how you're seen when you are running your clinics. You're seen by what is shown in your first and last name. So when that's done, you can hit save changes and you're done. I'm not going to save it because I'm going to decide to stay with my own name. If you wanted to put a profile picture up, over here with the gray kind of outline, you would hit change. And this gives you an opportunity to upload a picture that you have saved somewhere if you wanted to put up there. You don't have to put a picture of you. Some people put a picture of their dog or whatever they decide to. Obviously, please keep it appropriate. So I'm not going to put anything up there because I'm old fashioned and I don't really put my likeness out in the internet all that much. So call me crazy. So I'm going to hit cancel. So down here, the next piece I want to show you, and this is the unique URL that I spoke about earlier. I'm going to click this little show, which shows me this is my personal meeting number. And you'll see here on this URL right below, that meeting number is my unique identifier for my URL. That unique identifier is unique globally. That is your number. That is how people get a hold of you. So if you're booking for physicians and you need to say what is the URL that's unique that goes to their room, this is it right here. That string is the URL. So if I send that out, anybody who clicks on it is going to be put into my waiting room of my Zoom room until I start the meeting, number one, and until I actually admit them from the waiting room. I don't ever have to admit them from the waiting room. That has to be done. Again, that's that security piece. So I wanted to show you this. You do, if you look, there's an edit on the right. You can change that. We suggest don't because it's a unique number to you. If you start changing it, then if you've ever emailed this URL to somebody else and you've changed it after, the original URL won't work. For those who want to get creative, this personal link right below, this is simply an alias to the above link. So some people like to personalize their link that gets sent out. I called mine Virtual Dave. Luckily, no one else in the world had actually used Virtual Dave, which I'm quite surprised about, but I snagged it right away. If you want to change that, you can hit customize and it will allow you to enter a string here. You can't use punctuation or any capitals. It's just one lowercase long string. So what some people have done is they've put doctor, first name, last name, those types of things. You don't have to do this. I just wanted to point it out that if you wanted to, you could try it. Again, you would save changes when you're done. But just to note, this personal link is literally just an alias to your actual URL. Either one will get you into the room. Below this, there's a bunch of other information specific to your account. This is stuff that you wouldn't change. I would say just leave this alone. It happens to be there in your profile for information. It just basically states that when you have the healthcare grade account, you can have up to 300 participants in your room. I'd suggest maybe not, because that would get super, super busy, but you could have that if you wanted to. So there's other items here. If I went to meetings, I could do some customizations in here. If I did use the scheduler within Zoom, and again, you can use the scheduler in Zoom, but what we found is some folks out there, especially physicians, it's like if you start scheduling some things in Zoom and some things in Outlook and some things in the daybook, people are going to miss scheduled appointments. There's too many places to look for all their scheduled appointments, and that's why we recommend not using the scheduler and using what you always have used, and using that personal URL as the unique identifier within any kind of invitations. There's a bunch of other settings here. I'm not going to go through them all. I encourage you to take a look at them. And if you have questions, you can always reach out to me after the fact. I will click on the settings at the bottom. This is where you can change some of your settings, but as you can see, I have some of these. Administrator has locked the setting. We've locked those again globally to apply to all the RCCBC Zoom accounts, and some of these are done for ease of use, and some of them are done to protect your security and the privacy. So if it is locked, you're not going to be able to unlock it. If it's not locked, try it out if you want to. You can always revert when you're done. So this is the profile on the web. Basically, when you log in, if you sign into the website like I showed you initially, this is where you can set up your profile and do these types of things. You don't have to. When you first initially set up your account, you set up your name there. It's if you wanted to dig in and play around. So I'm going to go ahead and close this here. And at this point, I think I'm going to just jump right into in-meeting navigation. So I'm going to show you first the Zoom client, and that's the Zoom client that I just showed you, where you are going to, you can go and download it once it's installed. This is what it looks like. Can you thumbs up if you can see that? Yep. All right. Excellent. So right now we're in an active call. That's indicated by the top right here. You can see there's a red video camera. That means it's active. So normally, if it was not an active call and you just logged in, this join, the share screen, all these things would be active. Right now they're grayed out because we're in a meeting. This return to meeting button would say start meeting, I believe it is. And so that's how you literally start your session. When you want to start your Zoom room, which is like your virtual exam room or your virtual room, you'd click that button and it opens up into the room that you guys all see right here.
Yeah. And just like, it's called new meeting.
New meeting.
So
good.
That is the button to start a meeting. Don't get confused by it being called new, but
Yes.
That is the button to start.
Thanks, Tom. I knew I was like, start meeting doesn't sound right. So yes, it's new meeting. All right. But again, I encourage you to play around with this tool. One thing we strongly suggest is when you get your account, if you try to play around with it when you have a patient visit within 10 minutes, you're trying to book, you're not in the right headspace for it, and it's going to be confusing, and the technology will frustrate you. What we suggest people do is when you get your account, there's no limits to it. In the evening, use it to connect with friends and family. You won't get Zoom bombed because you're using the healthcare version. Connect with your friends, connect with family who are maybe self-quarantining. Use it in that non-stressed environment. Use it when you don't have the pressure or where you're in that medical headspace where you want to keep focused on the clinical. Play around with it. Hit a button. What does this do? What happens when I share my screen? Do those types of things so you can normalize on it a bit. So when you do use it clinically, you're not getting hamstrung by what does this button mean or what does this button do? You're familiar with it and you can focus on the medicine side, which is what we're there for. So this is the home tab, as you can see in the top. The next tab is the chat tab. The chat tab here is where you can actually do secure chat. As you can see, Tom and I have been doing chat in here. This secure chat is completely encrypted and it is completely secure, so you can chat to other users that are available, that are showing available. You can see on the left side here, some of these are the people I've chatted with before. And just want to show you the chat feature. Some people use it, some people don't, but it's another way to secure chat with someone who has Zoom. The next feature, the next button is meetings. So in here, as you can see, there's the personal meeting ID. It's the unique identifier again. Some of your Zoom clients, if you're on a health authority computer, won't have this personal link displayed right here. They've decided to take it out. But if you're wondering where you would see that, if you show down here, show meeting invitation, and I want to show this because I don't like it. I really, really dislike it. The meeting invitation, if you were to send it out via email, has all this mess in it. It's very confusing. People look at it and wonder, what's this H323 nonsense? What's all this stuff that's going on? All they care about is join Zoom meeting, and it's this piece right there. There's a unique URL again. So again, we suggest people don't invite via email. If you invite via email, the email address of the Zoom room is exposed now to the patient or to whomever, and the email invite will have all this mess in it, and I guarantee you it'll create confusion, and people won't be they won't be sure what they're supposed to actually do when they see this. So again, we suggest just the unique URL, which is this, and you can also access it in your profile. I just wanted to show you that because I dislike it. So the last button here is contacts. Contacts is where you can add your contacts. You can see here, I have some contacts that may sound funny, like RUDi and Intensivist. Once we're done going through the Zoom basics, I'm going to talk about the real-time virtual supports pathways, and I'll explain what they are, and I'll come back to the screen and I'll explain what these mean. So there'll be more detail about this. But in here is if you added contacts, you'll see your contacts showing up here. If you have an RCCBC account, there are several contact groups. One will say all. Those are all the contacts within the RCCBC pool. We have it set up the way as the main phone directory, if you will, so you can search for anybody within the pool if you need them. When you need to search for somebody, you can go to the search field and you type in the first 3 letters of whatever they've named themselves, and you'll get them to come up. We're going to show this next within the meeting navigation. I'll show you what that looks like. So you don't need to know their full name. So if I was trying to find Tom in here, and I didn't have him in my contacts, I could just type the first 3 letters, which happens to be his entire name, and his contact would show up. If there are multiple contacts that have the first 3 letters, you'll see a bunch of them, and you can select which one you're looking for. So that's the Zoom client screen. If I go back to home, there is a little gear icon here. And what this does is it opens up a settings window. In here, you can do a lot here that you can do in the portal as well. I'm not going to go into all these. I encourage you to poke around in here if you feel like it, turn things on, turn things off, see what you think. Play around with it. Again, that's the big thing. If you play around with it when you're not in a situation where there's pressure on you, you're going to get used to it, and then it'll be easier to use when you are in that clinical headspace, and that's where your focus is lying. So I'm going to close that. So, all right, I'm going to take this screen out. Now it's going to get a little bit trippy maybe. I'm putting the actual Zoom meeting screen that we're all attending, and I'm sharing it. So this is what the Zoom meeting looks like. In here, I'm gonna basically, when you start your meeting, it will, I'm gonna minimize all this, a sec here. When you start your meeting, this screen will look like this, and you'll see a picture, a self view of yourself larger than life on the screen. That's what it looks like by default when you start. The panels that I just hid are panels you can add, and I'm going to go through each button on the bottom, which are in meeting navigation buttons. Those are the buttons that you're going to use to hide and show panels depending on what you want to do. So on the bottom left, you'll see mute, pretty self-explanatory. You can see my little mic is moving because I'm not muted and I'm actually talking. If I wanted to mute, I'm going to mute shortly and you'll see what it looks like. So there's a little red line through it when you're muted. That's how you can tell. If you are on a computer that has multiple mics or multiple speakers on it, if you hit the up arrow, this is where you get to choose which ones you want. You can also do a test speaker and test microphone. On health authority computers, a lot of them that have dual monitors, they have 2 cameras, 2 mics, sometimes 2 sets of speakers, and that ambiguity can be confusing. So if your audio is not working, sometimes you have to go into here and just try a different one and see if it works. Then open it up and try the next one until you get what works. The next piece is stop video. By default with RCCBC accounts, we have all video on because if we're not going to do a video call using Zoom, we may as well just get on the telephone and go backwards. So we force the video on. That said, if you want to turn your video off like many of you have, you can click that button and that will stop the video. I'm going to show you one piece here. There's a little arrow up. And again, this is if you have multiple webcams. Again, on health authority computers, if there's 2 monitors, you may have 2 webcams. You would just select the correct one. I'm going to show you a cool little feature. Everyone loves to look at it. Choose virtual background. So if I go into here to choose virtual background, right now I have none selected. However, if I wanted to go and put something back, and that's where you're working from home and you want to hide your environment from whoever the meeting is in, you can change. They have a couple built default. So if I change that, now you can see I actually now I have space behind me, and you can see them disappearing into it. And that's because these are designed for a green screen, kind of like the weather, like people who do the weather, they stand in front of a green screen and then it looks nice and even to the viewer. So if you have any kind of depth behind you in your room, you'll see my hand keeps disappearing. That's why. If you hung like a simple bed sheet behind and made it all the same, this would be a much better solution. There's a couple built-in ones. The ones with the little video camera, they actually have motion. So now you can see with the northern lights, there's northern lights behind me. If you want to do your own thing, which a lot of people have, you can click the little plus, and in here, I can either add an image or add a video. So this is where a lot of people, they've put like, you know, a picture that they've taken when they were hiking, or a picture of the river, or a picture of their dog. A lot of people like to put pictures of their dog. So just like to touch on that. So this is where you can add your own custom image behind you. I'm going to go back to none because I don't have a green screen behind me, and I find that can be confusing for some folks. So that's the start. That's the little feature. Everyone always asks, that's how you get to your virtual background, and you can get creative as you want. The next icon here is the security icon. If I click that, you can see enable waiting room is on. I can decide to lock the meeting. And again, locking the meeting it's an additional lock that really isn't necessary, because if we force everybody into the waiting room, if you are in the waiting room, you cannot be brought into the session unless the host lets you in. Period, the end. You cannot circumvent that. Currently, we are on an operations Zoom account right now. What that means is we have some features that are turned on here that are not available in the healthcare clinical version. We do that because some of it we want to be able to test with, and for this one we're recording. Recording is turned off by default for all the health grade versions because that is a privacy breach, so you cannot record a session. So that's the security button. Manage participants. I have managed participants. On your screen, you'll have participants. I have the word manage because I'm the host of the meeting. So if I click this, this opens this panel on the right side here. On the right side, I see all my participant list. This is where you can manage your participant. As you can see, I've made Tom co-host. You can make somebody co-host. That way they can manage the room with you if it's a big meeting. So in here, you can actually mute and unmute people. If someone's not sure how to mute and it's disruptive, you can put the mouse over them. And right now I could unmute this person, or I could mute them. It'll toggle back and forth. There's another feature here in more. This gives you more options what you can do. This is where I made Tom the co-host. This is where you can put, if you're seeing a patient, back into the waiting room. If you see a patient and now you want to do a consult, or you need to make a phone call on behalf of that patient, you can pop them back in the waiting room and then bring them back into the actual active session when you're ready to finish the meeting with them. It's important to note that that feature's there because sometimes you want to move patients around in and out of the waiting room, and this is how you do it per attendee. The bottom one is remove, and it's important to note if you remove somebody from your room, the idea is it is over. They are not going to come back into your room, and it throws them out of the session completely. If they click on the link again to join, they cannot join the same active session again. When you remove them, it's implied that they're not allowed to be back in. So this is how you put somebody out. If they did want to come back and you did this by accident, you'd have to stop your meeting. And I'm going to show you how to do that shortly. And you have to restart your meeting, and then they could jump back into your waiting room. So let's see. I'm going to pick on somebody here to show the waiting room mechanism because it shows up in the participants. And I'm going to pick on you, Judy. Sorry, but I know you, so I know you'll be a good sport. I'm going to put you in the waiting room, Judy. Just please wait there. I'm going to do a little chatting here, and I'm going to bring you back in from the waiting room, and I'm going to show people what that looks like. Oh, hello, Judy.
Hi there. I just said, okay, sounds good.
Okay, awesome. Thank you. So let's see. Let me find. Okay, so here's Judy. So if I go to more and I need to put her in a waiting room, I'm going to go ahead and pop her into the waiting room. As you can see at the top of the panel, it shows that Judy's back in the waiting room. Everybody who is in the waiting room will show up here. So if you have patients, you may see numerous people there. I can either choose to remove them, and I already discussed remove is an absolute thing, or I could admit Judy back in, and that would bring her back in. So you can put people back and forth between the waiting room. So I'm gonna go ahead and admit Judy. And so just by hitting admit, and then she's back in the session and she should show up when everything connects. So that's a mechanism how you can move people back and forth in the waiting room. That's some of the things you can do as the host. You can control that. So if for some reason you forget to open your participant panel and someone's in your waiting room, you'll get a notification that'll show up right on your main screen that somebody is in your waiting room. So you won't miss it if you forget to open this panel. The next icon is polls. We have this turned off by default, but it is in your personal settings that you could turn it on if you wanted to do some polling. I'm not going to get into that because from a clinical point of view, generally you wouldn't conduct a poll. But that's why that's showing up there again, because we're in an operations account and we have some of these things enabled for operations purposes. The next one is chat. If I click that, as you can see, a chat panel opened below the participant panel. And this is where folks have been putting questions in there. And so, you know, luckily I have Tom here helping me out. So Tom could reply to these chats to some of the questions, or, you know, if you're co-hosting meetings, someone could note what the questions are for the Q&A period. This is also where you can chat to everybody if you wanted to put up a URL or if you wanted to give some information. Right now, you can see the bottom, it's set to everyone. So if I chat in here, every one of you will see what I want to say. If I want to have a sidebar in a meeting, if I click the little arrow, as you can see, everybody that's here, they're in here. So if I, for example, clicked on Guy and I said, okay, I need to have a sidebar with Guy, I could start chatting with Guy and he would see the chat and no one else would see the chat. So if you're in a situation, that's an opportunity within the chat to be able to do that. So I'm gonna minimize chat here. All right. So next button is share screen. So what I've done is I've shared my screen. When you click the share screen, this is the window that comes up. So I have two screens on my computer. I shared the second screen so it's easier to bring things in and out. If you don't want to share your screen, and you need to understand, if you share your screen, anything you have on your screen will be seen by all the participants. If I wanted to just share an individual application, say I had a Word document, or say you're a physician and you wanted to show somebody their labs or show them an X-ray, you can select the application that's open and you can click on it and it will be the only thing that gets shared to the participants. So you can control what they see and what they don't see. If I wanted to say, so I'm going to share my whiteboard, this little share button down here, I would click the blue and then that would share whatever I have selected here. So I just wanted to point out that's how share works. Since I'm already sharing, I can't reshare something else. So I'm going to close this window. Next to share, we have some recording buttons. Again, you won't see that in the health grade version because that violates privacy. So that is not enabled for any of the healthcare versions of Zoom, and that applies to all the health authorities as well as RCCBC accounts. So reactions, I could go into it. I guess I'll go. As you can see, this is where you can put a clap or a thumbs up if you want to. So if you want to, you know, be interactive in the meeting, you could do that. Can't see how that would be applicable clinically, but you never know. So that's what the reactions does. The next piece over here is end meeting. I have end meeting because I'm the host. All of you have leave meeting because you're attendees. So say the session is done and we're done for the day. If I hit end meeting, it gives this window. If I hit end meeting for all, we're all done here. Everyone gets kicked off. If I click leave meeting, because I've made Tom the co-host, the meeting will continue and Tom will be the host of the meeting. Or I can hit cancel, which is what I'm gonna do because we're probably not ready to end this meeting. So that's how you end your meeting. I just wanted to point that out. So I'm gonna hit cancel there. So that's your in-meeting navigation for the window. Again, we encourage people, play around, start the meeting, send your URL to friends and family when you're not under pressure. Mess around with these types of things. You know, it's worth playing around. You know, it looks simple when you're looking at it, but the bottom line is when you're in clinic, it could be a situation where you're like, wait a minute, I thought I knew how to do this, and you don't want to be in that situation because you know you're in the clinic headspace now, and you want to make sure you're focusing on that. So I'm going to take this window out of here, so it stops that. I'm going to unshare. So now that I'm sharing still, I'm going to show you one more piece. I can't show you because it's part of my share screen, so I'm going to do a quick snip of my screen to show you. If you're sharing your screen, what you're going to see is this. This snip right here. Oh, wait now. Let me drag it. This is what's at the top. You can see there's a little stop share. When I want to stop sharing my screen, I would click stop share, and that's going to end the sharing session. So I'm going to do that now, and we'll go back to the regular view. So that's how you stop sharing your screen. And now we're back into the regular view here for the meeting. So the next piece I want to talk about, and this is a part I want to kind of focus on a bit for today, because people have been using Zoom now for a bit. Our CCBC has had Zoom out there for 2 months for their users. A lot of the health authorities have had theirs out there for, you know, a little less than 2 months probably. A lot of people are familiar with Zoom, so I'm not going to get too much into the basics. That's why I say play around. I encourage you to poke around, mess around. If you run into something you're not sure what it does, feel free to email me, get a hold of me. I pretty much work 7 days a week these days, like probably everybody does in this call. So, you know, I will try to reply in a timely manner with your question. And if you need be, we can jump into a quick Zoom call and we can do a demo again. So just want to make sure everyone knows that I'm available for this. So what I want to talk about now is the RTVS pathways. RTVS is real-time virtual support. And what the real-time virtual support is it's an RCCBC initiative. For those of you who remember or knew about the pilot program that occurred for the past 2 years, it was called RUDi. It was an app on your iPhone or iDevice where you could just tap on it 24/7 and get an intensivist on the line with full video to support your case. That pilot ended. There was a 30-page report done by UBC, and it showed that it met a need that is not being met anywhere provincially. There's a big gap. A lot of rural physicians, a lot of times at 2 in the morning, you know, they get called in. It's them and a nurse, and somebody has presented for some emergent situation, and you know, maybe they present with something that maybe the rural physician hasn't seen for a bit, and you know, that raises anxiety. It's like, I got to figure this out. It's just me and the staff that I have here. We have some sites, you know, they're so short staffed. They get the ambulance crew to come in and help with the patient. So what these pathways are is these are real-time supports. It's the next generation of the pilot I just referred to as RUDi. This one's called RUDi. So what RUDi is, and this is part of the overall pathways, it stands for Rural Urgent Doctor in Aid. The acronym is not necessary to memorize. That's just what it stands for. What RUDi is there is a pool of 30+ rural physicians out there who have walked in the same shoes you have. And they also have eMERGE background. So they also work in the eMERGE, and the rural physicians, most of them are eMERGE certified. They have stepped up and they have basically said, we're going to help man these supports for all the rural physicians out there. So we have a schedule where they're on 12-hour shifts, 7 a.m. to 7 p.m. If you need to access them, and I'm going to demonstrate how to do that shortly, they're available 24/7. They're available to physicians out there, they're available to nurse practitioners, and they're available to nurses. A lot of First Nations health authority sites and a lot of sites out there, there's not a full-time doctor. And so these are the most vulnerable sites. These are the sites that need that emergent help when someone walks through the door or is brought through the door. It's critical that that gap is bridged, that they have somebody they can call or have multiple people they can call. So these, and I'll go into a little more detail on that. So those are the groups, you know, where if you have any issue, you can bring somebody at the tap of a button, real time, a physician to help you, to look over your shoulder. There's a number of, I know in the Northern Health catchment, there are 21 Northern Health ERs that currently have iPads in them. The divisions had a project and they put iPads in them that are on hands-free stands. And they also have SIM cards in them, so they have a redundant network connection. And they have Zoom on them with a generic Zoom account. So if you're there and say, for example, you're a nurse and somebody presents and you page out your doctor and the doctor's like, okay, I'll be there in 15 minutes. You can get that iPad hands-free. You can tap the RUDi pathway. You can get the physician there with you in the room as the physician on call is coming in. Or maybe there's not a physician on call that is coming in. Maybe it's you and the virtual physician. And so that's a scenario where you can get somebody right there and they can see what's going on. They can see the monitors, they can see the patient. You can use the iPad to show them affected area if it's a situation like that. They're that calming voice in the room that isn't in there with you, but they are in there with you. It's important to note that everybody, when they're on duty for RUDi to support you, They are not in clinic. They are not on duty in an emerge. They are off duty, so they are there to manage your case 100%. They're not going to be distracted by other patients. It's important that they can focus on what you need, and to do so very compassionately and empathetically, because the chances are is your adrenaline's going to be racing and there's going to be anxiety, and they're there to help. So look at them as a friend who's going to help you. They're the physicians that we have manning these lines. It's not just having the medical ability, it's also having the right approach, and that we're all in it together. And how can I help you? It's basically that how can I help you approach. That's a critical piece of it. There are no dumb questions. There are no stupid questions. No one's going to yell at you because you should have done something or you shouldn't have done something. They're there to help. So it's important to note that. That's a cornerstone of these pathways. So that's the RUDi pathway. I'm going to go over the different pathways, and then I'm going to let you know, and then I'm going to show you how to get to them. So the other pathway that's available 24/7 is the ROSe pathway. And the ROSe pathway consists of all the intensivists that used to support the Cody pilot, for those who remember those days. These are the same intensivists. They've been providing this support for close to 3 years now. They're very experienced at it, and the same applies to them. They are not in an ICU managing patients. They're there for you, and they're there to focus on your case. They're available 24/7, and you would access them the same way as I'm going to show in a second here. So those are the two kind of emergent pathways. It's important to note that you don't have to have an emergent case to contact them. They're the ones that are available 24/7, and they're prepared for an emergent case, but you can contact them anytime, even if you don't have a patient in front of you saying, I have a difficult patient, I have a difficult management plan, I'm not sure where to go with this, I need help with medications. This is a peer. If you're in an environment where you could walk down the hallway and ask a peer, this is what you do. You're just doing it virtually. So these two supports are to be used as needed 24/7. There's a third support, and I'll point out in a second. It's the rural dermatology support. Their hours of operation are Monday through Friday, 9 to 5. You can do the same thing. You tap on that. They have an iPad. You'll get a dermatologist. If you have a patient in clinic, that dermatologist will be right there. They can see the patient, they can see the affected area, and they can help come up with a management plan. I know a lot in the north right now, if you need to see a dermatologist, you're going to get referred, you're going to wait a year, you're going to go to Vancouver, if it's okay to go to Vancouver or travel, and you're going to see a dermatologist. You get to see a dermatologist right away using this pathway. So this is something where it's in clinic, you now have access to a dermatologist via this virtual pathway. We are also discussing with Children's Hospital to provide another pathway for pediatrics if you need pediatrics. There's geriatrics that we're talking to. We're talking to mental health and addictions. The idea is when this is done, when we get to that point, you can open up your Zoom and you can go into these pathways and you can figure out which specialty do I need access to? How can I best get the help for my patient that I need right now? And you can bring them in with video to help you with that plan. So it's kind of changing the face of healthcare, I guess, if you want to look at that. But with technology now everywhere and growing more and more, it needs to be leveraged to bridge this gap that there hasn't been a bridge to date. Those are the pathways. So I'm going to show you now, I'm going to share my screen again, and I'm going to show you in the client how you access these pathways. So back in the client, here's the client. When you go to contacts, and this is how it looks externally. So I'm going to show you the external first. If you don't have an RCCBC Zoom account, you got your Zoom account from FNHA or from PHSA or some other group, you can still access these pathways. They do not show up in contacts by default because RCCBC has no control over the contacts and the other health authorities. So what you can do is there's a process to manually add the contacts. So when you get it, you can, and we have it, it's on the RCCBC website. I'm going to show you it shortly, and you can reference it there. The first time you log in, you can go ahead and set up these pathways. Basically what you would do is you'd hit this plus sign here above, and I want to add a contact, and you'd put the email address of these pathways in here. You have to do it for each one. You'd put the email address in there. That contact request would go to the RCCBC account. It would be approved, and from then on, that contact would show up under your external contacts. So I have external shown here. As you can see, Intensivist 1, that's the ROSe. This little icon, this green icon, shows that they are available for a call. Below that, you'll see there's other contacts here. You have RUDi 1, 2, 3, and 4. Right now, you're going to tell which one's active. That RUDi 1 is active during the day, RUDi 4 is active during the night. You don't need to remember that. How you can tell which one is active is there's a phone number behind it. This phone number, and it's the same for the intensivist pathway. If you make a Zoom call and they don't pick up, because the Zoom ring sometimes is a little bit low, if they're asleep, they may not hear the Zoom call come in on their phone. What you would do is you need to use your traditional telephone and you would call this. This cell phone number changes as each physician comes on duty, that they are required to update that cell phone number with their personal cell phone number. So if you need help and you didn't get them through Zoom, you can call them using a standard telephone call on that number and say, hey, I need help. Can we jump into a Zoom call? Then they would hang up the phone and you'd come back and you'd try them via Zoom again. As you can see, I'm hovering the mouse over it. If I want to try them via Zoom, I would go this little icon, invite to meeting. When I click that, that rings on their device and they will be put into your waiting room. They'll pop into your waiting room. You'll hit the admit into room button and they'll be in the room with you. So this is how it looks if you do not have an RCCBC Zoom account. This is how it looks when you manually populate these. I'm going to show you now a graphic of what it looks like if you do have an RCCBC account. Let me bring that up here. So, oh, that's a little bit small. So this is what it looks like. In here, you actually have under all contacts, these are automatically populated. You can see here, there's the rural dermatology. You can see their hours of operation are 9 to 5, Monday through Friday. If there are no hours of operation listed, that means they're available 24/7 for support, to support you. Dermatology right now, due to capacity, they wanted to be a part of this and they wanted to provide their services, but they're only available to do it during these hours for now. Same thing applies if you don't get them live. You then have their cell phone number right there that you can call and you can ring them on their traditional phone and say, hey, I need a consult, and then you can jump back into Zoom for that video consult. You'll see some other groups in here. These are some experimental groups. There's some pilots that are going on. You can ignore those for now. The ROSe support. If you have an RCCBC account, you'll see this ROSe support. When you expand it, you'll see the same intensivist contact that you saw on the external contacts. Same goes for RUDi below. So you have the 4 here. The one with the phone number is how you can tell if it's active or not and ready to be contacted. You can see if you highlight it on the right side, you have a meet button and you can hit that meet button and that just dials right into Zoom for them and they'll get the call and they'll jump in and they'll help you out. So that's the internal view of the contacts. So let me minimize that. I'm going to show you what the status means now. So this is another graphic that shows the same thing you've just seen. If at a glance you want to know what's going on, over here you can see the availability displayed. If there's a gray circle, that means the account, that support is offline. Don't bother calling, no one will answer. If you have a green rectangle, as you can see over here, for example, for RUDi 3 or RUDi 4, that means they are available and they're on their mobile device. If it's a green circle, there's not an example here, but it's a green circle, that means they're available and they're on a computer. To you, it doesn't really matter if they're on the computer or on a smart device. It just matters that they're available and that you can call them for help. So I just wanted to let you know that's what those mean. The important one is if there's a red video camera, it means they're in a video call already and they're working on a case with somebody else. They won't answer the call if you call them. So if you see that red video and you're like, but I need help, go to ROSe. Call ROSe. Even though they're intensivists and they're trained in critical medicine, they are still available for you for any questions you have. So at any given time, you have one ROSe support and you have one RUDi support that you can call. So you have 2 supports 24/7. We have additional accounts in here for RUDi with the idea that if COVID goes sideways or something blows up, we have physicians that have graciously agreed that we can give them a call and they will log into those pathways right away and they will provide more supports real time on the fly with their cell phone numbers as a backup. So we can scale out the support if we really needed to. So those are the availability little icons. I just wanted to show those because those can be helpful. at a glance, and I'm not going to get too into this, but if you look here on this website, and this is the RCCBC website, I'm going to show the URL in a minute. Down here, this is where you, if you want to go to the website, this is where it walks you through how to add contacts. If you're an FNHA Zoom account or a non-RCCBC Zoom account, this is how you would add these pathways manually. It's on the RCCBC website. For any FNHA staff that are on this call, Erin Tedesco is also going to be in contact with you, and she will be providing you these steps so you can have them for reference as well. There's also a link on the RCCBC website here that Tom has created, and that basically is a little video tutorial of how to add these contacts in if video is better for you than following the steps. I do want to point out, I'm going to go back here. So this is the RCCBC website. You can see here RTVS. That is the real-time virtual supports. If you are curious, if you go to this URL, this is where everything I'm talking about is explained in detail. There's some diagrams that show the workflow for these different supports. If you look at the left side column, if you want more information about Zoom licenses from RCCBC for rural physicians and MPs, this is where you would go, and it tells you how to get your Zoom license, your free Zoom license from RCCBC. If you want some more information on RUDi or ROSe, there's also the Doctor of the Day. There's an FNHA plan, which has been quite successful. It's the Doctor of the Day program, and this is a virtual doctor for patients who need to see a doctor, and they may, they're First Nations patients. They may be living in community. They may be living out of community. This is another support for them. There's more detail on this page around each of these programs. Below here, I'm just going to take a quick look here. This is what it looks like. I encourage people to take a look here, read up about it, see if you have any questions. You can reach out to RCCBC through their contact information, and there's someone who's always manning that, and they can reply back and answer any of these questions. I'm not going to dig too deep into this because I just wanted to touch on that. So I'm going to not share my screen, and we're almost wrapping up the presentation point here. I did want to make one important note for FNHA staff that are on the line, especially nurses. Erin asked me to make this point. For those of you who are working in nursing stations where you don't have internet access or you don't have Zoom access, I know some sites are quite remote and they have a traditional telehealth cart connected to a satellite connection. And so you don't know, well, who's on duty for Zoom and those types of things. Erin is going to be, she's going to be providing the schedule for RUDi for each month. In that schedule, it'll show you who's on duty when and their cell phone number. Your workflow process is going to be, if you need help, you need to call the cell phone number of the person who's scheduled to be on duty, say, hey, I need help. I'm in such and such community. I just have a cart here. The RUDi physicians have a list of FNHA sites of each site and what each cart is and how to contact that cart. We're going to be doing training sessions with those physicians starting tomorrow to demo how to use Zoom to call a cart. Zoom is 100% compatible with traditional video conferencing equipment for all health authorities. So the Zoom physician can then, if they know that you need help and they know you where you are, they find on their sheet, they will start Zoom and they will call your cart, you'll answer, and then you have them in the room. It's important to note, if the RUDi physician is there and they're in the room and they're helping you and they're helping the physician, they're helping you with a case, and there's additional supports needed, they have the ability and the know-how to bring in a RUDi. If they need some critical care, they can bring in a ROSe, an intensivist, right into the same call. So now you have them and an intensivist in the room. They also have the ability, if you need to transfer the patient out, to start engaging PTN on your behalf while you keep your hands on the patient and on the management plan for the patient. So these virtual physicians, there's a lot they can do for you. You need to just tell them what you need. They're there to help you in any way you feel that they could be helpful. So I just wanted to make that point. Erin asked me to make that point. Specific to the FNHA staff who are in these nursing stations, she is going to be communicating the schedule to all of you, as well as how to add Zoom contacts if you have an FNHA Zoom account. She's going to give you the information on how to do that. And again, if you have any questions, you can reach out to her or you can reach out to me through her. That's perfectly fine. I'm available to help out anybody one-on-one, to another group, whatever you guys feel would be helpful. So at this point, I'm going to stop talking because I've probably talked enough. And this is the Q&A piece. And I guess, you know, if you want to just please unmute yourself and just start talking if you want to. I'm going to let Tom talk right now. He might have a better strategy for the Q&A.
If you you can start talking, you can also put a note in the chat, and I'll monitor the chat and keep a running tally of who needs to speak. The one piece I did want to touch on is if you are inviting patients to join a Zoom meeting with that personal Zoom URL Dave talked about at the beginning of this, the way for them to get into that meeting is you need to first start the meeting. So we talked about opening up the Zoom client and that big orange button, which will say new meeting. Hit new meeting. That's like turning on the lights at the clinic. So your waiting room that we've discussed doesn't work until you start a meeting. So remember to start your meeting first, and you can leave that meeting running all day. Patients can just sit in the waiting room until you admit them, but start that clinic, start that meeting, and that's when the lights go on and when people can get in the door. So when you click end a meeting at the end of the day, that's when you're shutting the lights off and you're done for the day. And that meeting link will no longer work until you hit new meeting again.
All right. Questions? There's no bad questions either. Feel free to fire away if you have any questions. You can always email me. I'm going to actually put into the chat my email address for those who don't have it. You can always email me if you want to ask a question after the fact. So this is my email. I monitor it as long as I'm awake. If I'm not awake, then I don't. So I'm sorry, Joanne. I'm unfamiliar with the WOTJ acronym. If you can you unmute and just explain that to me, please? Oh, typo. Gotcha. So no, that's okay. So basically, that's a great question. In a lot of cases, you know, family members, when they go see a physician, they feel more comfortable if they have other family with them. You know, they may not want to see the physician on their own. It's a great all you have to do is, if you want to include family members in the actual you know, visit with the physician, is you just need to get them the same URL that you're going to use. Again, that URL is unique. Any family member can click on that. They will be put into the waiting room. It's important that you let the physician know in there what the name is, because you don't want to admit people that are not the right people. If by accident you admit somebody into the room that isn't supposed to be there, again, we went over how to remove them. You can remove them immediately and they're not in the room anymore. So what we suggest is, when booking staff are booking clinic visits with patients, tell the patient they need to use their real name, because the physician will not allow them to come in from the waiting room unless they recognize them as their next booked scheduled appointment. This is also, just to expand a little bit, this is a great tool that we've had great feedback from physicians. You know, if there's family members that want to attend the doctor's visit that are not in community, or they're like, you know, somewhere else in the world, all they need is that link and an internet connection again. You know, if it's kind of, you know, a palliative situation, you can bring family members in from all over so they don't have to travel, and they can have those conversations with the physician and with their family member in the room, everyone having that virtual conversation. So again, you can have up to 300 people in the room. I should just note, because that's crazy, but you could if you wanted to. So, great question here about the EMR. So the RCCBC is partnering with Northern Health, and we're very thankful for that. They are working with Northern Health and AIHS. They've stood up MOIS, which is the EMR that's used in the North. It is a provincial version. And so what happens is, if, say, for example, you had a consult with a RUDi physician or a ROSe physician, they have access to this EMR. It ties into all the EMRs in the province. So they could put a patient note in, they could put their consult note, they would put it into the instance of the EMR, and that note will then make its way to where the patient record actually lives. So there's continuity there of making sure that the consult was recorded. Again, Northern Health has been awesome about doing that. They've partnered greatly with RCCBC, and they're providing this support on a provincial level. On that note as well, I'd like to also note that all the RUDi physicians, they have contracts. The government, the Ministry of Health is paying them for to support these lines. And again, I'd also like to acknowledge the fact that Northern Health has been gracious in they're hosting those contracts for the physicians. So, you know, RCCBC, while this is an RCCBC led initiative, we are partnering with Northern Health and other health authorities in a way that is incredible. And that's basically all together, we're providing these critical support. So I just wanted to make it a point just to mention that. Yeah, there is only one RUDi physician on call throughout the province at any given time. So the idea is we're monitoring load all the time. So if we start seeing busy signals or people are like, you know, I tried to get a hold of him and RUDi wasn't available and ROSe wasn't available. Again, that's why we have multiple. We have RUDi 1, 2, 3, and 4. We have multiple accounts created with the idea that if load went up and things spiked and all of a sudden there was a lot of supports needed, we can add them real time. So now there's more pathways to support. You'll notice if you take a look at it, RUDi 1 is used for the day shift for the RUDi physician, and RUDi 4 is used at night. And the reason why we do that is because RUDi 1, if there's a physician who's on the day shift and they get a call for help at 6:45 p.m. and they're going off shift at 7 p.m., if the RUDi physician coming on at nighttime were to try to log in using the same account, it would kick off that case and all those supports would be gone for the person who just engaged it. So we have them separate. So if there is an overlap at shift time, the one case, someone logging on to start their shift won't affect an active case. And that's why we have it set up. So even though maybe like, well, which RUDi am I calling? The great way to look at it, to wonder, you know, well, you know, who's what? Look at where the cell phone number is behind it. At the beginning of their shift, they enter their cell phone number for that backup, and that's how you know which RUDi line is on shift. If that's helpful to answer that question. Let's see, chat's quieted down. I know it's Friday afternoon. I know I'm looking forward to sitting outside and having an adult beverage, but I'm here to answer questions. So if anybody has a question, please go for it. Wow. All right. I guess all my talking paid off. Again, you guys have my email there. Please feel free to reach out, email at any time. If you have any questions, again, there's no bad questions. Please let me know if there's anything I can help with. You know, even if it's not RCCBC Zoom related, if there's any questions dealing with virtual medicine, and if there's any other questions, you know, we have a lot of great supports within RCCBC. We have a lot of relationships with the DTO and with health authorities. You know, I can help find somebody, you know, to help you out with your specific question. I used to work for Northern Health for 4 years as a telehealth analyst, so I still have a lot of contacts there. I have contacts within other health authorities that we work with a lot. So, you know, if you just can't find answers to something, if you feel like it, email me. I'll do my best to track down somebody to talk to or a support for you. And I just want to make sure that that's clear. Any question out there, please let me know. And again, thank you for your time. I guess we're going to wrap it up for today. So thanks again for your time. I really appreciate the turnout. We had an excellent turnout. We're going to do this again next Saturday, I believe, for those who couldn't make it. And enjoy the rest of your day and enjoy your weekend. Thanks again.